Good evening, everybody. Thank you for joining us on this new webinar series called Paving Pathways by North Carolina Movement Association. So today we're going to go over some introductions. We're going to introduce our speaker, and then we're going to dive into those interview questions and then close out. So my name is Brittany, and I am a board member for North Carolina Women Association.
Hi, I'm Lisa, and I am volunteer with the North Carolina Home Women Association.
My name is Lita, and I'm one of the high school volunteers. The purpose of this webinar series is to expose Hmong students and community to different career opportunities and provide them with valuable information and sources. Our objective is to address gaps in the community, expose students to different career opportunities, and provide information and resources for them. Our first speaker of this webinar series is Sylvia. She's a licensed clinical social worker who owns the Guiding Light Counseling PLC, which is a private practice providing online counseling in North Carolina. She has spent 9 years in social work practice and worked with individuals. Being an EMDR trained therapist, she utilizes the eye movement desensitization and reprocessing, which is an evidence-based psychotherapy technique that enables patients to naturally heal from the negative impacts of distressing life experiences. Sylvia provides a safe space for those who have been affected by depression, anxiety, PTSD, intergenerational trauma, relationships and attachment issues, and life stressors so they can move towards a place of healing and empowerment. You're welcome to contact her at guidinglightcounseling.info.
Yay, thank you so much for being here with us, Sylvia.
Of course, and thank you, ladies, Brittany, Lisa, and Lita, for having me join you guys in North Carolina Women's Association. I'm glad to be here.
Since we're done with the introductions, let's move on to the questions next. What is your job title?
So I am a licensed clinical social worker, and you did a brilliant job already introducing that, and also the owner of Guiding Light Counseling.
What are the roles and tasks of your job?
So as far as clinical roles that I have, I do diagnostic assessments. This is where I'm assessing clients' mental health needs, their symptoms, behaviors that might be causing any kind of impairment in their functioning in various settings, such as work, school, social, interpersonal, or their home life. Also, to help them develop treatment plans. So, this is where I'm collaborating with my clients on goals and objectives, and providing interventions for them to be able to address and promote their well-being. I also provide counseling. So once we've already identified the objectives and the goals, we move into the counseling part, which is whenever I'm using the evidence-based psychotherapy techniques such as EMDR or parts work, also known as ego state or internal family systems, to help support them and reaching their goals, to develop these coping skills that they might need, enhance self-awareness, or also just helping them find some inner peace within themselves to make a positive change. I also collaborate with other healthcare professionals such as psychiatrists, psychologists, nurses, or doctors to ensure their continuity of care. Other things that I'm also doing in my role here is providing referrals to other specialized professionals if I am not skilled, or whatever they're needing is beyond my scope of practice. And another part of my role is documentation and record keeping. This is very important to be able to maintain accurate and confidential client records. The documentation includes the assessments, treatment plans, progress notes, or other relevant information in compliance with legal and ethical standards. I don't do aftercare for crisis interventions, but if a client does need a crisis intervention, we go over what their crisis plan is going to be for after hours. So this is where I will give them like the crisis number that they can contact, so that if I'm not available to them during office hours, then they can contact those for support after hours. other roles, because I am in private practice, I have to do my own administrative roles and tasks. So I also answer calls or return phone calls. I send out and respond to emails. I'm doing the scheduling for the appointments, verifying insurance, sending paperwork and consent forms to the clients before starting therapy with them. Also collect payment and take care of the bookkeeping and payroll. I file records and forms in order to send payment to the North Carolina Social Work Licensing Board in order to continue the operation of my practice.
That's interesting. That's a lot of roles and
Yeah.
tasks.
It is, yeah. So
Yeah.
yeah, private practice.
Mhm.
I was gonna say, yeah, you do a lot. You're like superwoman.
Yeah, wait till you hear what my superhero power is going to be.
I'm excited for that question. Yes. Oop, let's see if I can. Here we go.
How does your job or roles contribute to making a positive change in the world, and more specifically, the Hmong community in North Carolina?
So I believe like with what I'm doing now, I'm able to bridge that gap to mental health for our Hmong community by providing them a safe and non-judgmental space for Hmong women and men so that they have access to quality mental health services.
Mhm. Um, how did you become interested in your career?
So I actually started out going to college for a business degree. And before graduation, I found out that I was missing one elective. And so I decided to take a sociology of the family class at CVCC. And turns out that that was very fitting for me. I understood everything in that class and it really spoke to me. And so that led me into this career path. I actually started out with a undergraduates in human services and not social work. But once I completed that undergraduate degree, I wasn't able to find a job, and so I decided to continue my education, and I ended up going to UNC Charlotte into the social work program there, and wanted to actually become a school social worker first, but found that I really didn't have a passion or an interest in just attending like truancy court all the time with students who are being truant at school. And so started pursuing my second year, I started pursuing into a new area of focus, which was more with therapy and in a day treatment program and a school-based therapy program that they had. And fell in love with the idea of being able to do one-on-one counseling. And so I decided that I was going to continue and get my licensed clinical social work. Um, so that way I can do diagnostic exams and be able to provide the therapy treatments that I'm currently doing now.
I see.
Uh,
So,
okay. That's awesome how like you sort of just find your passion through like the journey of life, and then it just sort of
Yeah.
takes you through like once you find it, it's like you go even deeper and find like more specific things that you want to do. So that's awesome.
Yes.
Yeah, and just to pick back off of Brittany, I love how it just started with taking one class, that sociology class. You would have known that would have brought you down this path. So that's amazing.
Right, right. Yeah.
uh, speaking of classes, what type of schooling do you need to become a licensed clinical worker?
Yes, so you do need to go into a university where they provide a social work program for you. And so for me, it was a 2 year experience in the education program. And so here is a little bit of what different routes that you can take as far as becoming a licensed social worker. Um, So for someone who is doing an undergraduate in social work, you just once you complete that bachelor's of social work, then you can. This actually doesn't require you to do a 2 year for your master. You can actually complete it within 1 year since you've already got the foundation of social work in the 4 year program. So with the advanced standing program for the masters of social work, graduates can be eligible for that program. And then for those who are like me that did a non-BSW pathway, you can either study psychology or sociology or human development for your undergraduate degree. So, like for me, I did the human service degree and I moved in to pursue my master's. And so that took me 2 years of education at the university that I had attended. And so once you've completed the Master's of Social Work program, then you can apply for your licensed social work degree. And so you would have to go to the North Carolina Social Work Board and apply for the LSWA, which is an associate's application that you have to apply for. And the application fee is $145. Once you've and you also have to have a professional references. So this can come from your instructors at the university or a field instructor that you had, or someone that like your supervisor at your internship, and then a sealed transcript with that application. Then after you've submitted that, you'll receive your A, which is letting you know that they've issued you to be able to begin accruing those supervised clinical hours. So you are required to gain experience before you can become a fully licensed clinical social worker, and you must complete 3,000 hours of clinical social work experience um, and 100 hours of supervision. Once while you're doing that, your internship or your required experience, you are to report to the board every 6 months. Um, and then also you're required to take the ASW clinical exam. So this is an exam that basically confirms that you have the education and the skills in order to become fully licensed. And then once you've completed the exam, then you can submit for the LSW application after completing the 3,000 hours and the 100 hours of supervision.
Wow, that's a lot of steps.
Yeah, it is a lot of steps. It took me about 2.5 years. Typically, it can take anywhere from for individuals that if they start early, it can take them 2 years to complete. But for some, it might take you a little bit longer. And if after the 2 years, you do have to resubmit another application for the LSWA in order to continue to work under that license. And so there are some agencies that will actually pay for all of that. If starting off as a LCSWA, that they will actually pay for supervision and your LCSW application, so that you're not having to pay that out of pocket. So that was really helpful for me to be able to find an agency that was supportive of that.
Cool. Let's see. What are important skills to have in your career?
Yeah, so skills, I would say, as far as with social work, being a licensed clinical social worker, active listening skills. So being able to listen purposefully, carefully, and with curiosity and compassion, and observing not just verbal messages, but also nonverbal messages as you're actively listening to the client. Being able to validate and provide appropriate feedback to show the client that you are actually listening and they're being seen and heard. So being attentive, and this will also establish the trust and mutual respect between you and your client, so that they are going to be able to open up to you. Um, Empathy is another important skill to be able to have. I think that if you're going into this role, you already have most of these skills. You know, you're empathetic, you care about people, and that's why you chose this career. So the with empathy, you know, you're able to identify with the individual and understand where they're coming from and their points of view. Other communication skills would is also important, such as, you know, for documenting, because you do have to have written communication skills to be able to write out a treatment plan, or even to communicate with other professionals to advocate for the clients that you're working with. Being able to set boundaries is also an important skill to have, because oftentimes whenever you're working with a client, you might have clients that come in that are needing a higher level of care, and so, you know, being able to set that boundary with them so that they're also putting in the work, and you're not overworking yourself by putting more effort than the client is. Critical thinking is also an important skill to have, and so with this, you know, being able to help solve problems with facts that the clients are giving you. Um, and time management, I think that's a really important one to have too, because, you know, with you could tell with all the roles that and the tasks that I had just explained that I'm doing, without time management, I don't think I would be able to get everything done. And so being able to know where you need to put your time, and manage that. Um, yeah, but
Thank
those are the most of the main skills that I would say. And one last skill that I would like to just emphasize is, being able to, with with clients, being able to sit in silence. I think that was a skill that I had to really learn, because oftentimes, you know, if you're too quick to speak, then you're not really giving your clients time to reflect internally. So sometimes, like, you know, you want to just fill in the silence by just by talking. But if you're able to just sit in silence and just be reflective with them, that really shows them that you're patient and you're waiting for them, so you don't need to rush the process.
Thank you for such a thoughtful answer, Sylvia. I think some of those skills and characteristics you talked about really emphasize like a patient or client first approach, which I really love, you know, putting your client first
Hmm.
since they're there to seek help. And I also love how you mentioned about having boundaries, because it's important to have that to prevent burnout on your side as well. So I
Oh
love that.
yes. Hmm. Hmm.
Um, do you have any advice for people aspiring to study and work in this field?
So my advice that, you know, with this field, it's important to do some work on your own mental health, um, because, you know, some of us, we chose this career path because maybe we've experienced some things that have been in our lives that maybe have caused us to have depression or anxiety or any trauma in our lives. And so if we're planning to work with individuals that are coming to us for help, we do need to do work on ourselves. So seeking out your own therapy is very important, so that you are going to be able to be present for your clients, um, and having that support, in this field, and being able to, like, you know, even with education, like the education piece, going to school, that can sometimes be, if you're trying to juggle school, work, and family, that can be very, very difficult to do, because you're being pulled into different roles, and so that can cause a lot of stress in that. So being able to have good, self-care practices that you're doing for yourself as well. Like for me, when I went into the master's program, I was already a mother of two, and having to travel, you know, an hour to school, a couple times a week, and then also doing my internships. That was taking away from my kids, and they were young then too. And so being able to juggle all of that, and so that can cause a lot of stress. And so being able to just know that, you know, there's support out there. Ask questions, seek support from those who have been through this process as well. You know, I'm available to you guys, and so whenever if you have any questions, please feel free to reach out. Um, and education is not
Yes.
cheap. I think I what was that? Did someone
Huh?
say something?
No?
Sorry, I thought someone said something. But yeah, so education isn't cheap, and so, you know, I think that sometimes that can steer people away from getting a higher degree too. But you know, there is support with especially with this type of work that we're doing here. LCSWs, once you become an LCSW, you can qualify for loan forgiveness programs through one of the programs that I did was HRSA, which is a NHSC loan repayment program, but you are required to work at least 2 years at a NHSC approved site in a health professional shortage area. So that could be anywhere, any agency such as public or nonprofit private medical facilities that serve a population or geographic area with a shortage of providers. Um, I actually worked for a federally qualified health center, and that was for 2 years. And but after my 2 years, I continued to work with them a little bit longer. But it can really help support that student loan there, and they can pay up to about 50,000 for a 2 year initial term, and I think it's up to 25,000 for a 2 year initial term. So for half time, so full time for someone who's working full time, they can get their student loans paid up to 50,000 for a 2 year term, and then for half time employment, up to 25,000. So, and one thing that I remember hearing a lot in my in my at the university that I was going to in my program was that being a social worker, you don't get paid a lot, but for me, I don't believe that. I think it's how you choose to pursue this career, is where you're going to find that there are some financial benefits and some, you know, some benefits within yourself. Because with me, I feel like being a social worker has really helped me be more insightful and have more self-awareness of myself.
Mm.
Thank you so much for sharing about those student loan forgiveness programs because yes, we do need them. Education
Right.
is not cheap at all. So that was definitely good to share. So thank you for that.
You're welcome.
What does a typical day look like for you?
So for me, because I am in private practice, it is a little bit different from being in an agency setting. And so for a typical day for me, I make my own hours. So I work from 12 to 9 and I'm working from home. So since it's online, a typical day is I will come out to my office, get set up, wait for my first client to start at 12. And from there, I just see clients. I do take breaks in between. So I set like a 30-minute break in between each client so that I can either just, you know, has a little bit of downtime in between in case if I had a really difficult session. Um, Also, bathroom breaks, very important. And also being able to eat something if I need to in between clients. Um, if I don't have any clients, so there are days where I might not see, like, you know, I might have like maybe just 4 clients scheduled. And so if it's like a longer break in between, that allows me to actually get to spend some time with my 3-year-old who's at home. Or I'm able to go and cook a meal or take a nap if I need to. And then I'll also handle administrative tasks in between clients and after hours.
Mm. Well, that kind of answers the next question.
Yes, for the set hours, yeah.
Yeah. What is the best part of your job?
I would say that the best part of my current job, right? is that knowing that I'm providing quality care for my clients and being my own boss. So I get to set my own schedule. I don't have to ask anyone for time off. I can just schedule time off for myself, just let my clients know that I won't be in the office and go on vacation. And I'm also able to, if I'm traveling to another state, I'm able to still continue to see my clients if, like, let's say that, I'm scheduled to go on vacation and I want to put a couple hours in, I can still schedule clients while I am away from my office and be able to still provide them therapy.
Mm, that's nice.
Yeah, relatable. I also work remote. So it's nice to be able to bring work wherever you are. So
Hmm. Yes.
What are challenges in this career and how do you overcome it?
Yeah, so challenges can be one major thing. I work a lot with clients that have trauma, and so sometimes I could develop vicarious trauma, which is secondary trauma where I'm hearing about all of their traumatic experiences. And so I might be taking some of that home with me. And so that can be very, very heavy. I don't really have any colleagues or someone that I could just call and talk to about those things, right? And so it's really important that I have self care practices and also seek out my own therapy if I need to for that. Other challenges could be personal life issues or experiences, stressors that I'm dealing with as well. So that can sometimes interfere with with my ability to stay present, and so being able to just make sure that I'm taking care of myself through that process. I also have some challenges sometimes with imposter syndrome, and I think that everybody could probably relate to that. When you're doing something, you feel like you're not, you have that self doubt that starts setting in. And so, I could feel like that sometimes if I'm feeling stuck with a client, and being able to seek out supervision or consultation to help support that, additional trainings if I need to make sure that I do have the skills to be able to work with these clients that I'm seeing. Also, being able to challenge my own negative beliefs and self doubts that I have that might arise because of the challenges that I'm facing.
Mm, I see.
I agree. Imposter syndrome is real.
Yeah.
And I appreciate how you don't let that weigh you down, like you mentioned, seeking like additional education material and other methods or ways to continue to overcome that and improve yourself. So I think that's great.
Yes. Hmm.
How does being a Hmong woman impact your work or role?
So I believe like being a Hmong woman, I really don't see it impacting my work or my role because I feel like if anything, like it doesn't impact me negatively. If anything, it impacts me more positively because if I'm facing any kind of adversities, I tend to be very optimistic and I use that to push myself, right? And so, like before, I would say like maybe in my younger, like in my 20s, I was I would be more quiet and passive about things, just because of my, like the upbringing of being like you have to listen to like your parents, or you can't go above your husband, but I have such a good support system too, so that I feel like that helps me overcome any of the adversities that I might be experiencing. And so I see it more as a positive impact for me because I can then empathize and relate with some of the challenges that my clients are facing, but be able to use my own life experiences and help them.
Hmm, that's very interesting and admirable that you could, that you don't let things weigh you down.
Hmm.
Um, what if there are individuals wanting therapy but can't afford it? What are some resources you can recommend to them?
Yeah, so for high school students, right? Or are you asking for just individuals in general?
Individuals in general.
Yeah, so um there are, as far as like um supports out there, um if they don't have, let's say that, I know that sometimes insurance can be a little bit tricky because of the co-pays. They can be really high, and so it can make it a little bit challenging for them to pay for therapy. There is an option to opt out of using your copay and doing a sliding scale. So there are some therapists that do offer sliding scales. Like if you go on Psychology Today, you can actually filter it so that you can have a sliding scale on their website, and find clinicians out there that are offering sliding scale fees, and that could be anywhere from 20 to like $50 per session. And then they do have interns too that offer sessions for like 20 to $25. Other ways, if they don't have any insurance at all, they can go to a federally qualified health center, and be able to do a sliding scale there to see if they can qualify there for any services. And they will see you even if you don't have the ability to pay for services. So I really like that about that program there. Um, there are other support sites for resources such as NAMI. They do provide resources for individuals that are seeking therapy, and they don't know where to go. And so they can help you actually find resources in your area that will be able to accommodate your needs there. I would say also, if you can't afford therapy at all, there are apps such as Calm. It has over 100 meditation sessions that can help you regain and control your thoughts, reduce some of your anxiety, and lower your stress levels. So being able to utilize those apps can be helpful too, as a like more like a self-help way of being able to support your own mental health.
Mm. I'm glad to know there's a lot of stuff we could, people could go to for help.
Hmm.
And
Um,
Sylvia, I apologize. I think originally when I had sent you the questions, it said high schoolers
Yeah, yeah.
on it. And then I was like, oh, I forgot to start we sort of updated it a little bit last minute. So sorry for
Oh
that.
no, no worries. Yeah, but
Um,
I did have, for as far as for high schoolers though, um, I would say a free resource that they do have in their school is their school counselor. So going to their school counselor, because that person is there to help them as well. They might not be able to provide them like one-on-one therapy, but they can actually like just talk to them and kind of help them see where they need to go with that too.
mm,
yes, thank you for bringing that up as well, because I know a lot of it might seem like intimidating at first for high schoolers to sort of like go to their counselors and open up. So it's good to know that they
Yeah.
are there for a resource.
if you could have any superhero power, what would it be and why? How would you use that superhero power?
Okay, so this question, I was like, man, what do I want to do with like what superpower do I want? And I pondered and pondered, and I figured out what I want. It's super speed. And why is because sometimes I feel like I just don't have enough time in the day to get everything done. And so with super speed, I feel like I could be able to take care of things at home and then also complete all my paperwork that I have here. Because I feel like with what I do in my role, documentation is probably one of the pieces that takes me a little bit longer because I tend to overthink and what I want to put in the documentation, because I have to, since I do see clients that have insurance, and there is this like whole list of things that we have to make sure that we have in our progress notes. And so being able to have super speed would probably help me be able to document a little bit quicker.
Yeah, that's understandable. You just gotta make it fast.
Yeah.
Um, well, that's all the questions we have for you, Sylvia. Thank you very much for taking the time to join us.
Oh, you're welcome. Thank you for having me.
Yes, thank you again. It's always a pleasure having you join us. And I learned so much about your career and your roles that you do. So that was very informative, and I cannot wait to share this. So thank you again.
You're welcome.
All right, have a good night, everyone.
Good night.
Thank you. Good night.